that you're looking at right there, that is the dark side of the moon. And so this is all about moonshots. And who just went to the dark side of the moon a few days ago? But China, exactly. So they landed a spacecraft with a rover on the dark side of the moon. And I apologize for the lighting there. It is the dark side of the moon. Doesn't get a lot of natural light. So what was the biggest challenge that they had? Was it thrust? Was it landing struts? No. The biggest problem was communication. You see, the dark side of the moon faces the other way. There is no line of sight. Radio waves can't get from there to Earth. And so they had to deploy a satellite called the Chi-Chow to be able to relay the communications. Why? Because constant communication with that spacecraft and that rover was essential. And so that's the analogy that I'm going to dig into here today is, you see, healthcare is faced with the same challenge. We don't stay in constant communication with our patients. We don't have line of sight on how they're really doing between visits. How can we change that? How can we make healthcare proactive rather than just reactive? Continuous and collaborative rather than just episodic. And so it's our belief that ongoing conversations, staying in touch with patients between visits is essential, because otherwise you're not going to know how to apply your resources. You're not going to know about those moments that matter. And so at Conversa, we deliver personalized care through automated digital conversations. And so chatbot, conversational AI technology to stay in touch with patients. But rather than hearing from me about the product and how it's helping to transform healthcare, I want you to hear from the most important people that there are, and that is the doctors and the patients who are using the technology today. And so we're gonna hear from Dr. Suit Teki, who is a radiation oncologist for Northwell Health in New York, one of the biggest health systems that there is, and her patient, Rod Houston, who has a diagnosis of throat cancer, and you can see a chat that Rod has with the bot over on the right. Let's hear from Dr. Teki.
We needed to find a way to bring our care of our patients into the digital and modern era. And it was so analog. It required so much phone calls and doctor's visits. And our patients with head and neck cancer are really complicated. They're dealing with a lot of symptoms. They have a lot of questions. And we thought that this engaging platform that really allowed the patient to have a conversation with somebody effectively from our team would be a really nice addition to their care, improve their care, give them some value that they weren't getting through the usual doctor's visits.
You see, Dr. Teki doesn't see this as a replacement for her care. She sees it as an extension of her care. She wants it to be her brand, her knowledge that's extended throughout the course of this patient's treatment.
It's been a really interesting experience to use. I've used it so four of the 5 weeks of my treatment plan, and I generally have a chat at least once a week. I was already kind of familiar with the concept. In fact, when Dr. Teki described it to me, I said, "Is it some sort of a bot?" And she said, "Exactly." So it didn't really require any sort of cajoling, or I was very sort of comfortable with it from the outset.
And so meeting patients where they are, using the most comfortable form of communication that there is, conversation. Think about how that changes healthcare, and so different from the portal experience that we might have today.
One of my patients actually would come into the office 2 days after he'd done the chat and say, "Oh, I chatted with you this weekend." Even though he knew it was a chatbot, he just felt like he was speaking with me. So I think that it's a really nice way to add that personal component. I guess it sounds like our voice, the way we would normally speak to the patient, so they do feel that it's a connection to their team.
And so think about that. A patient knowing it's a chatbot, but saying, "I chatted with you this weekend," and how helpful that was for their care. They see it as so natural an extension of the care that they see it as an extension of the person that's delivering the care.
I think, so we've designed the head and neck cancer chat to start from before the patient actually begins treatment with radiation, continue during radiation, and then follow them afterwards. And I think that the value comes from really two facets of the program. One is that the patient's actually able to tell us how they're feeling in their own voice, or using what we use in the National Cancer Institute, the patient-reported outcomes criteria for adverse event reporting. So it's a really patient-centered approach to reporting their symptoms. So I think that that gives a lot of value because it's not us coloring the patient's experience, it's the patient telling you their experience firsthand.
So hearing from a patient in their own voice, using their own words, expressing how they're really doing between visits, a level of transparency and honesty that we really haven't had in healthcare in the past.
Well, I like the idea of sort of being able to have a connection to the doctor even when the doctor isn't present. So it could be on the weekend, it could be late in the evening, it could be at a time when, you know, the doctor isn't necessarily working. I can go to the chat and get some questions answered. I don't necessarily use them whenever they come. I'll go and get a chat whenever I can. Just recently, I was experiencing some dry mouth. It's one of the symptoms. And I went to the chat and it just so happened to be talking about that particular subject, gave me some tips on how to get some relief from the symptoms, and that was very helpful. And I didn't need the doctor to be there. And then the doctor is able to know that that is something that I'm dealing with, so the next time we do speak, it's something that she's already aware of.
Think about how important that is, meeting the patient where they are on their own schedule. Such a scary diagnosis of cancer, but anticipating their needs before they even arise.
I think just to echo what Rod said, I like that our patients can come into each weekly visit with some information and education on their own, and they are starting from a place of information as opposed to a place of unknowns and anxiety and fear. And I think that that improves the relationship you have with your patient overall, just because they feel more empowered in their care.
Before co-founding Conversa, I ran all products and strategy at Press Ganey. Now, many of you might know Press Ganey as the CAPS survey company that delivers that for most of the hospitals in the US. And I want to point something out in this chat right here. That last question, did you find today's chat helpful? 97% of sessions, patients say yes, today's chat was helpful. No two patients ever get the same conversation. No patient ever gets the same conversation twice. The reason I bring out the Press Ganey reference is that question right there is something you will never see on a survey. Did you find today's survey helpful? It wouldn't make any sense to ask that because it's not helpful to the patient. Gathering patient experience of care, CAP survey, is not meant to be helpful for the patient. The patient knows that. This kind of interaction, though, conversation, a natural way to elevate the patient's position to be an equal partner in their care. Now, let's think ahead for a moment. How does this kind of technology actually transform how we deliver care? Once you start meeting every single patient where they are based on their own unique circumstance, start having an automated conversation with them, how can we change healthcare now to be proactive, to using this information to focus their time and costly resources on the right patients at the right time? Everybody's different. How can we use technology to make sure that we are turning healthcare into a continuous and collaborative process? I can tell you it's only with heroes like Dr. Techie and Rod who are willing to go that next step and start to use technology as an extension of their care. And I'd like to recognize Dr. Sweet Techie, if you could stand right now. So a round of applause for Dr. Techie, who's truly a pioneer in this area. And so that's our moonshot. Our moonshot is to change healthcare to be continuous and collaborative using this technology. And I welcome you to try a conversation. Text hello to the 5-digit short code 77877. Have a great festival. It's been my pleasure talking with you. And so welcome to the Startup Health Festival.